Hello everybody, I'm Aaron with Medicare Prepare, and in this video I'm going to show you how to find the Medicare Part D prescription drug plan that best fits your specific medications and pharmacy, and how you can enroll in that plan yourself without having to even speak with an insurance agent like us. Now, we already know a few important details about the 2027 Part D plans. The maximum deductible is $700, and the maximum out of pocket limit is $2,400. But the plan that works better for one person may be completely different from the plan that works for somebody else. So, your prescriptions and dosages and pharmacies and premiums and drug costs all matter. Not all drugs are subject to the deductible. I'm going to walk you through this step by step, show you how to enter your medications, compare the plans, and when it comes time, enroll in that plan. Okay, let's get started. Go to medicare.gov. And this is the page you'll likely see. This changes from time to time. You're going to press this button right here, Find Health and Drug Plans, and then you're going to put in your zip code. All the drug plans have availability based on where you live. It's your zip code and your county. Here on the next screen after continue, we're going to put in drug plan because we're specifically looking for a drug plan. Here they're asking if you have any financial assistance with your medication costs. Do you have Medicaid, SSI, the MSP, Medicare Savings Program, Extra Help? We're going to assume that there's no assistance right now, and we want to see the raw cost of these medications. Now that we have completed that part, we're going to put in, yes, I want to see the pricing of my drugs. So at first, I am just going to put in a few the most commonly prescribed drugs in America. This is at atorvastatin. You can select your dosage. I'm going to leave the regular one that they auto-populate with. I'm going to add another drug that's very common, levothyroxine sodium, which is very common. Here it is. I'm going to use the default 50 micrograms, but again, you could change the dosage as it comes in so many different varieties. I'm going to add a few more for rosuvastatin. This is, again, a very common drug. I'm not going to change the quantities or the dosages. I'm just putting in a number of these so that you can see how easy this is. This is something you don't even need us to do if you don't want. So once I put in a few drugs, I'm going to press continue, and I am going to select pharmacies within a certain radius of where I live. So 5 miles, you can select whatever mileage you want. I'm just going to use 5 miles. I'm always going to add mail order because I want to compare mail order to some of the most popular pharmacies out there. I'll look at the Walmart. I usually look at some of the local ones, Nico's. Then I'm going to press continue. I'm comparing multiple pharmacies here. All right, so here, if you look at the bottom, you'll say, right here, you can see that they're showing 1 of 10 drug plans that are available. There's 10 drug plans available in this county. And right now, what's happening here is they are listing them in order of overall cost for this drug plan, for the medications that you are taking. Health Spring Assurance comes up as the least expensive plan. This is taking into consideration the premium of the plan, the deductible of the plan, the copays associated with the plan. So it's taking all of those costs and it's saying, hey, with this plan, you're likely going to pay for the rest of the calendar year. This is August of 2026. You're going to pay about $160 at a retail pharmacy for your drugs. And below that, you can see the other figure, you're going to pay $288 at the mail order. So we can compare plans, but right now, if you can see it's $160. As I scroll down the list, that number is going to get bigger, $169. This WellCare Classic, $214. If I go down to the bottom, it's $727, right? We don't want to make a mistake here. So when I go back to the first plan, I know I'm going to go through this fast. I'm committed to a 5-minute video here. We're going to see the plan details, and it's showing us a summary. Hey, the premium monthly is $35.70. The total drug cost at the pharmacy is $18 and mail order is $145. So now I'm going to scroll down to the drugs that I put in, and you can see these different pharmacies, they're all green, they're in network. Some are preferred. Every drug plan seems to have a preference, a relationship with the pharmacy or more than one pharmacy chain that's preferred. Generally, that ends up in lower copays. This is the screen I want to see. This is the cost by pharmacy. It's showing your copay per drug. And at the bottom, it shows you your total estimated drug costs for the remainder or the rest of 2026. We can see with this particular plan, CVS will be the least expensive at $18. If you go to CVS, you're going to spend the $18. So this is a nice chart to have, right? It's showing you your monthly total copays for your medications across multiple pharmacies. This is a very, very nice tool. I'm going to go back to search results. And as you can see, again, if I go down to the bottom, the worst choice for your particular medications combination of is this AARP plan because it has a high premium, right? It has the premium is 163 a month, 163.70 a month. Has a small deductible of $130. However, the deductible generally only applies to more expensive drugs on tiers 3, 4, and 5. These medications were all tier 1 and tier 2. So now I'm going to add some other medications. I'm going to go back to my drug list. I want to add some drugs that are very common that are expensive. Eliquis, that's a common drug. It's not a cheap one because it's a brand name drug. And when I add even one more drug, I'm going to add, I don't know, Manjaro. This is a common drug, expensive drug that you may need to know about. So now I've got all these drugs. I added the other ones. I'm going to continue. I'm going to keep the same pharmacies. I'm going to continue. So now it's showing me that this WellCare Value Script program will be the least expensive from a premium, deductible, copay perspective for the rest of the year. I'm going to check the plan details and go back to that screen that I showed you before. Okay, here we are. When we look at things like the copays, we can see the Manjaro has a hefty copay. This is showing 4 months. This is showing September, October, November, December. You're going to want to do this for 2027 after October 1st. That's when they have the 2027 plans into the medicare.gov system. All right, so you can see that your total cost here at CVS is going to be $844 for the remainder of the year. Same at Walgreens. Those are the preferred pharmacies. So again, if we go back to this screen that's showing us the drug plans in order of cost, if you look, the cost is going up, right? Now we're at 1,054. Here, the third one is 1,669. If we go to the bottom, 2,328. That's a big difference from 1,014. So you want to be careful in your selection of your drug plan. I'm going to make one more change. I'm going to go back to my drug list and I'm going to add a drug that is also very common called Zepbound. Here it is, Zepbound. I'm going to put this in. There's a number of flavors of the GLP-1s. Zepbound is one of them. In the meantime, I'm going to remove Manjaro. Now I'm going to continue. The pharmacies are selected, and it's showing me that HealthSpring is the least expensive option, again, for the last 4 months of the year at $6,083 projected. If I go down this screen here and I get to the last one that's available, it's $6,500. So it's a few more dollars. It's not really that much different, but it's, $400 a year difference approximately. I'm going to look at the plan details and I'm going to go back to that same screen where I've compared the pharmacies. Now, this is interesting, right? If you look at this, you will see the Zepbound is not covered. That's why the copays are so high. $5,252 for 4 months of this medication. You're essentially paying all of it. That's because none of the drug plans, the Medicare drug plans in this county cover Zepbound. I don't believe any plan in the nation will. I don't have that. I can't say that 100%, but certainly not here. Something your doctor may be able to write to the insurance company to get an exception with. However, just be aware that there are medications that are going to change these numbers, pretty substantially, right? I'm going to go back just one more time so you can see something else. I'm going to put in another drug. Whoops. Um, Dupixent. This is a common drug, an injector. I'm going to remove the Zepbound and let's see what happens here. Going through the same stages. And I want to see the plan details. All right. So we see that, all of these reach the $2,100 threshold. That's the maximum you can spend out of pocket for medications in the year 2026. If you reach that threshold and your drugs are covered, they're covered by the plan in the formulary, 2100 is the max, and you're reaching it here because the Dupixent is clearly, around $1,700 a month, right? So the point of this is once you put your drugs in, you can then look at all of the different plans available with your particular combination of medications and easily locate what will be the least expensive plan for you. Again, for 2027, I would not do this until October 1st. That's when they load the system with the 2027 plans. They're not showing those, though. That information is not yet available. You can do this with or without us. If you wanted to enroll, you would just hit this button here, enroll for 2027. And then it's letting you know what you're going to need to enroll. Then you join the plan. It's a very easy process. But this is how you confirm that you're making good decisions based on what we currently know. We can't predict for the future medications you may get prescribed. We can only go based on what we know now. And since the drug plans cover at least two drugs for most of the common conditions, you're in probably a very safe place by doing it this way. I don't think there's a better way to do this. I don't think that it makes any sense to buy the most expensive plan because you may not get the best results.